You sit down at your kitchen table, slide your arm into the blood pressure cuff, and press the button. The machine whirs. The nylon squeezes your arm uncomfortably tight, and then the screen flashes a number that makes your stomach drop. 165/95. Your heart rate instantly speeds up. A wave of heat washes over your chest, and your mind immediately races to the worst-case scenarios: a stroke, a hospital visit, the loss of your independence. You wait 5 anxious minutes, take the reading again, and it is even higher. 172/98. This is the exact moment when sheer panic sets in. You wonder if you should take an extra blood pressure pill, call your doctor, or have someone drive you straight to the emergency room. But what you do not realize in that terrifying moment is that the panic you are feeling is an active biological feedback loop. The higher the number gets, the more your sympathetic nervous system dumps adrenaline and cortisol into your bloodstream. Those stress hormones violently constrict your arteries, driving the pressure even higher. It is a runaway train, and your aging cardiovascular system has completely forgotten how to hit the brakes. Today, we are going to teach you exactly how to hit those brakes. We are going to bypass the slow digestion of medications and the standard, generic advice of simply taking deep breaths. We are going to show you 3 specific biological overrides that you can execute right there in your home to instantly force your nervous system to shut down a blood pressure spike. These are not old wives' tales, and they are not alternative medicine. These are deeply rooted neurological and biomechanical reflexes programmed into the hard drive of the human body. When executed correctly, they forcefully dilate your blood vessels and drop your heart rate in a matter of seconds. But to understand why these 3 tricks work so powerfully, you first have to understand why your body cannot lower the pressure on its own anymore. When you are 30 years old, your blood vessels are lined with highly sensitive microscopic pressure gauges called baroreceptors. If your blood pressure spikes from stress, these baroreceptors instantly stretch. That physical stretching sends a lightning-fast electrical signal to your brainstem, which immediately commands your heart to slow down and your blood vessels to open up. The spike is neutralized in seconds. But as you cross the age of 60, the structural architecture of your arteries changes. The flexible elastin in your blood vessels is replaced by rigid collagen. Your arteries turn into concrete pipes. Because the artery walls are now stiff, they do not stretch when the pressure goes up. Because they do not stretch, the baroreceptors are trapped inside biological concrete. They never send the rescue signal to the brain. Your brain has no idea the pressure is dangerously high, so it does nothing to stop it. Because your automatic sensors are broken, you must learn how to manually override the system. The first manual override takes advantage of an ancient, hardwired survival mechanism called the mammalian dive reflex. If you walk into any emergency room in the country with a dangerously racing heart, a condition called supraventricular tachycardia, one of the first non-pharmaceutical interventions an experienced emergency room doctor will use involves a basin of ice water. Here is the deep physiology behind it. You have a massive, highly sensitive nerve running through your face called the trigeminal nerve. It is strictly responsible for transmitting sensory data from your face to your brain. When this specific nerve detects sudden, intense cold, combined with the holding of your breath, it sends a red alert overriding signal straight into your brainstem. It tells your brain that you have just submerged headfirst into freezing water. To keep you from drowning and to rapidly conserve oxygen for your brain, your central nervous system instantly triggers a massive parasympathetic shock. It forcefully shuts down the adrenaline drip, slows the electrical impulses in your heart's natural pacemaker, and dramatically decelerates your heart rate. To use this reflex to instantly break a blood pressure spike at your kitchen table, you do not need an entire bathtub of ice. You simply go to your kitchen sink, fill a large mixing bowl with very cold water, and drop in a handful of ice cubes. Take a deep breath, hold it, and submerge just your face, specifically your forehead, your eyes, and your cheeks, into the ice water for 10 to 15 seconds. If bending over a bowl is too difficult or causes dizziness, there is an equally effective modification. Grab a gel ice pack from the freezer, hold your breath, and press the freezing gel pack firmly against your eyes and the bridge of your nose for 15 full seconds. The sudden, intense shock of cold to the trigeminal nerve instantly snaps your nervous system out of its adrenaline loop. The panic physically cannot coexist with the dive reflex. The heart rate plummets, the rigid tension in your arteries releases, and your blood pressure drops rapidly because the brain has been tricked into prioritizing oxygen conservation over the stress response. The second instant override is a pure mechanical hack for the most important neurological pathway in your entire chest cavity, the vagus nerve. When your blood pressure spikes and you are trapped in that sympathetic overdrive, your blood vessels are tightly constricted, acting like narrow, high-pressure pipes. You cannot just think your way out of this tension. You have to manually flip the biological switch back to the parasympathetic, rest and digest mode. The vagus nerve is that switch, and the fastest way to physically manipulate it is through the mechanics of your diaphragm. The vagus nerve travels from your brainstem, down through your neck, and passes directly through the diaphragmatic muscle in your chest. When you breathe shallowly into your chest out of panic, you ignore this nerve completely. But when you manipulate the pressure inside your chest cavity, you literally massage the vagus nerve into action. This is where the 4-7-8 breathing protocol ceases to be a meditation gimmick and becomes a clinical cardiovascular tool. Sit perfectly upright in your chair to give your lungs maximum vertical expansion. Place the tip of your tongue against the ridge of tissue just behind your upper front teeth and keep it glued there. Inhale quietly through your nose for a count of 4 seconds, aggressively pushing your stomach outward to fill your deep belly, not your shallow chest. Now, hold that breath for a rigid count of 7 seconds. This breath hold is critical. It slightly increases the intrathoracic pressure inside your chest, which forces the trapped baroreceptors we talked about earlier to finally register the tension. Now, forcefully exhale through your mouth, making a distinct whoosh sound, for a slow, agonizingly controlled count of 8 seconds. That extended, 8-second exhale is the absolute biological key to this entire mechanism. The slow, controlled release of pressure physically stimulates the vagus nerve to secrete a neurotransmitter called acetylcholine. Acetylcholine is the chemical brake pedal for the human heart. It binds directly to the cardiac muscle cells and the smooth muscle of the arteries, commanding the heart to decelerate and the blood vessels to violently widen. Repeat this exact cycle 4 times. By the end of the 4th 8-second exhale, you have chemically and mechanically forced the arterial walls to relax, completely draining the excess pressure from the system. The third trick addresses the pure, unavoidable physics of your circulatory system. Your heart is a mechanical pump fighting a constant, exhausting, 24-hour battle against gravity. When you are sitting up in a chair, stressing about the numbers on your blood pressure monitor, gravity is pulling your blood down into your lower extremities. Your venous system, the delicate network of veins responsible for returning blood to your heart, has to work incredibly hard to push that blood all the way back up from your feet. If your nervous system is panicked, it actively constricts your blood vessels to help force that blood upward, which inadvertently raises your overall systemic pressure. To instantly drop the pressure, you simply remove the burden of gravity from the equation and force it to work for your heart instead of against it. You do this through a specific biomechanical posture known in clinical therapy as a passive venous return, or simply putting your legs up the wall. You need to get down on the floor, ideally on a soft carpet or a yoga mat, right next to a blank wall. Lie flat on your back, scoot your hips as close to the baseboard as you comfortably can, and extend both legs straight up the wall. Your body should form a perfect 90-degree angle. Rest your arms completely flat at your sides, with your palms facing the ceiling to open up your chest cavity. Close your eyes, let your breathing return to normal, and stay in this exact, motionless position for 5 to 10 uninterrupted minutes. Here is the profound biological shift happening inside your cardiovascular system when you do this. By raising your legs vertically above your heart, you completely eliminate the hydrostatic pressure that your circulatory system usually fights against every waking minute of your life. The pooled, stagnant venous blood in your calves and your thighs effortlessly drains down the veins, pulled by gravity, and empties directly into the right atrium of your heart. When the heart muscle senses this sudden, massive, and effortless return of blood volume, a secondary biological reflex called the Bainbridge reflex kicks in. The heart instantly realizes it no longer has to pump violently to retrieve blood from the lower half of the body. It sends an immediate signal to the brainstem that the physical workload has been eliminated. The central nervous system responds by dialing back the sympathetic drive to zero. The arteries dramatically dilate, the heart rate smooths out into a slow, efficient rhythm, and the systemic blood pressure plummets because the physical, gravitational struggle has been completely shut off. A high blood pressure reading can be a deeply terrifying experience, but the absolute worst thing you can do is let the panic dictate your biology. The next time that digital monitor flashes a number you do not like, do not immediately take a second reading while your heart is racing and your adrenaline is surging. Stop what you are doing. Walk to the kitchen and use the ice water trick to trigger the mammalian dive reflex and shatter the adrenaline loop. Sit in a quiet room and execute 4 strict rounds of 4-7-8 breathing to manually stimulate the vagus nerve and flood your arteries with acetylcholine. Or lie flat on the floor with your legs straight up the wall to eliminate hydrostatic pressure and manipulate the Bainbridge reflex. You possess the biological tools to control your cardiovascular system. You just needed the instruction manual on how to use them. You must understand, however, that these 3 tricks are emergency rescue tools. They are the fire extinguishers you use to put out a sudden biological fire. They are not the cure for chronic, long-term hypertension. If your arteries are chronically stiff from decades of seed oils, systemic inflammation, and a lack of dietary nitrates, your pressure will eventually creep back up once you stand up and go about your day. You must still do the deep, daily structural work to rebuild your arteries and support your aging heart. But you no longer have to be a victim to sudden, terrifying spikes. This information is based strictly on clinical biomechanics, physiological reflexes, and emergency medicine protocols. It is entirely for educational purposes and is never a replacement for your personal physician. Do not ever stop taking your prescribed blood pressure medications without speaking directly to your doctor. And if your high blood pressure is accompanied by crushing chest pain, shortness of breath, blurred vision, or numbness in your face or arms, bypass these tricks completely and seek emergency medical attention immediately. Take exceptional care of your nervous system. Use these biological tools to stop the panic loop before it starts, and I will see you in the next video.